He knocked the cone over as he was pulling out, and as he put it in reverse to straighten the vehicle up, he stood the cone back up.
I think we should give him an award for re-standing the cone up perfectly.
I'm going to be, gut-wrenchingly nervous, but, it's what I signed up for, so.
Who is it?
Hi, it's paramedics.
What's happening?
How are you, sir? What's going on? Sir, can you please put that down for a moment?
Oh, you got cops out here?
No, not at all. What do you got, Nick? Anaphylaxis. He's got Strider up at the top, wheezes on all fields.
Are you able to talk to us at all?
So how long has he been like this?
15, 20 minutes.
And I see the peanut butter. Does he have an allergy to peanut butter?
Honestly, I don't
Nothing
know.
about a previous medical history or anything like that?
No.
I'm going to give him a medicine here that will help him breathe.
You're not giving him steroids or anything, are you?
No, it's not steroid, it's epinephrine. But big pinch in your arm, okay? It's gonna hurt. It's gonna make you feel a whole lot better. We're gonna need to just get him out of here.
What hospital are you going to?
Children's Hospital?
Does he have to go?
They'll be able to take care of him. Yeah, he really does.
So this is Ryan. He was being fed peanut butter by his father because he said he was hungry.
Take him straight to Children's.
We have no known allergy to peanut butter. However, we were found with rise and urticaria all across his chest. You can see up across his airway. I haven't been able to get a good capillary refill. I've not been able to get an accurate O2 sat either or a blood pressure.
You grab me a non-rebreather mask. We'll put him on some of those right away.
He has received 2 pediatric doses of Epi, 25 milligrams of Benadryl IV push, along with 40 milligrams of Solumedrol IV push. He has been sinus on the monitor, was originally at 120, is now down to 90 sinus with no ectopy. His respiratory rate has stayed the same. His blood sugar is 91. We have 22 gauge access in his left AC that we've been bolusing through.
This is amazing. This is really well put together, really detailed.
This is probably more stressful than real life. I think I'd rather do real life disasters than this because everybody's watching.
Medic 4, unknown trauma, 859 at 10th and Boston.
Please be advised, this is Trauma 4 from New Haven.
Hey guys, we're with the news. What's going on here?
Not really sure right now.
Yeah.
Ma'am, you have to put that back right there.
I really need help.
You can't go through this. Okay? You can't go through that. We're only here to help out and make sure the patient is okay.
Did he fall backwards and hit his head or anything? So this is Benny. He's 30 years old. He was at a bar. He had a flaming alcoholic drink and it flared up on him. He's got pretty good burns. It looks like second-degree burns throughout his body. He has some soot in his nose. He was cyanotic. I intubated him, and his skin color came back.
Se cayó para atrás y entonces no puede respirar y no se mejor. Look, I made it on the pretty colors.
I appreciate that. I don't need any of this stuff. Okay? I don't need your help right now. What you can do for me, can you stand with her? That's the wife.
He most likely had a head strike given the nature that he fell backwards right out of his bar stool, still had the stool under his feet. So we did C-spine to the best of our abilities. It was a hectic scene and we had to do a bit of an emergency move.
Don't go so fast. I can't walk that fast. Come back. Don't take him away without me.
Nope, I'm not going anywhere. He's a drug addict, heroin. Wife here, she's slightly blind, but she said that he didn't do any drugs today. He was upset. He had a beer before this, and then he had the drink that flared up on him.
All right, get this burned, sizzled drug addict out of my emergency room.
How did that run go?
It was even worse than I could have anticipated.
I mean, if this wasn't a competition, I would have loved this call.
It was super tough. Way more distractions than I would have ever imagined. Distractions,
Total
objects.
destruction.
Yeah.
Because it was a competition, I wish it was a little bit easier.
That was a very chaotic scene. We had bystanders pulling at ourselves and at our bags and offering us drinks and
2 great scenarios, the pediatric and the adult scenario. All sorts of modifiers, complexities in real life events, including equipment failure. So how to manage, even in a scenario, how to manage an equipment failure when the equipment doesn't work. What do you default to? How do you appropriately get back to good old clinical assessment skills?
And your first place winners for this year's national competition from Clackamas County.